They did an assessment and they said, well, you're a few points under depressed, so you're not depressed. And that was kind of the end of it. They were like, well, if you need some more help in the future, reach out. But I remember thinking like something is still wrong. I need help. And so like it doesn't have to have a name, but I still need support.
Welcome to Boundless B, the Hemophilia B podcast, the podcast standing with you from a family like yours, presented by the Coalition for Hemophilia B and in partnership with Balancing Life's Issues. We often talk about the physical side of bleeding disorders, but today we're focusing on the mental and emotional journey, grief, the questions, the courage, and the importance of being seen and supported. And to help us do that, we have asked Dr. Mosi Williams, licensed clinical social worker at UCSF's Adult Hemophilia Treatment Center, longtime advocate, speaker, and community leader to join us today. Welcome to the podcast, Dr. Mosi.
Hey, thanks, Kai.
Yeah, it's wonderful to have you. Start with a little bit of your background with hemophilia. Just let our listeners know what your background there is.
Sure. So I have severe hemophilia A. Was diagnosed shortly after birth, had a hematoma, and found out then that I had hemophilia. And so first one in my family, first child of my mom that we knew about. My mom was a carrier. So I'm 48 years old. So treatment at that time, this late 70s, cryoprecipitate. So kind of born during the HIV AIDS hepatitis epidemic. And so it was a scary time for our community. I contracted hepatitis C through treatment. I did not contract HIV, but due to that time, there were periods where we would not take replacement treatment because of the fear of that. So I remember being young and having a bleed and not having any factor and just I remember my mom just telling me, lay down and just visualize being in a cold room with ice and trying to like calm myself down because of the fear of using the treatments at the time. And so to go from that and then where treatments became more safe, and then I developed an inhibitor, which basically means the body fighting off the factor treatment or the treatment for hemophilia A, developing antibodies to that treatment. And so as a result, I ended up taking factor 9 products or hemophilia B products. They didn't have bypassing agents at that time the way that they do currently. And so that was my first exposure to what hemophilia B was. And so these times of uncertainty, so it's like one thing, okay, don't know what treatment's going to work. And that works, and all of a sudden that's not working. And then I have Hep C, and then this treatment's not working. So continually trying to find different things, and finally was able to tolerize, meaning you find a certain amount of factor 8 or for hemophilia A that I could use that my body would not reject. And that was at around age 20.
Wow.
So a lot of up and down before that time. And so I can remember just being frustrated in and out of the hospital and honestly, kind of tired of it, not really wanting to deal with it anymore. And so I think from that and having supportive people, supportive mentors and medical team, medical staff is what made me want to go into being a hemophilia social worker myself.
Yeah. Wow. I mean, thank you for sharing. I know that is going to be very familiar to a lot of people, especially the emotional struggles. So can you talk to us a little bit, because this is your expertise, like this emotional journey that hemophilia patients kind of go on. And can you take us back, like, what's that like as a kid, right? When your mom's telling you to lay still and act like you're in an ice bath, to like the struggles in early adulthood, to what seemed like not great news time and time again, right? Can you talk to us about what that does to us as young people and how we kind of like hold on to that in our adult lives?
Yes. I remember having bleeds and then not being able to walk and then not wanting to go to school because I didn't want to use crutches and I didn't want to be seen different because I had gone before. People, kids are, they don't understand differences sometimes and they'll make fun of you. So I didn't want to go. And it got to a point where my parents, mom and dad said, well, you have to go to school because you can't keep missing school because, you can have crutches, you can go, you can actually be there. It's just the shame and the fear of going. And so through those kind of times, I eventually did go back to school. I lost confidence. My esteem was low because I just felt like an outsider. I wasn't able to participate in activities, sports I loved growing up, but I always was having bleeds, so I wasn't able to participate as I would have wanted to. And so going into college, and then when I started to have more serious bleeds, I really became depressed. And I remember I had a job just working at the dean's office, and they said, well, you probably should talk to somebody. You probably should go to the counseling center. And that was the first time I went to counseling. And I went and I found it helpful. And this kind of plays into the rest of the story, is that they did an assessment and they said, well, you're a few points under depressed, so you're not depressed. And then that was kind of the end of it. They were like, well, if you need some more help in the future, reach out. But I remember thinking, like, something is still wrong.
Yeah, I need help.
Right, I need help. And so, like, it doesn't have to have a name, but I still need support.
Right.
And so that was something that kind of later in life, in terms of my own journey and then trying to help others, like, we don't have to have a name for this, but what kind of support can we give? And when we look forward to get some help.
Right. So you're saying that that moment for you is kind of when you made that decision to get into like more of the social work side of things, because you knew there are people out there who need help who aren't maybe necessarily like clinically depressed or like
Right.
defined by those terms.
Right, or defined by those terms, or if the clinicians, we make mistakes, or they missed it. It
Sure.
just didn't show up on that, because sometimes people will minimize symptoms, and
Sure.
so therefore some things won't register, and so all of that.
Gotcha. So, I think when it comes to like the physical versus the kind of emotional, mental piece of navigating hemophilia, like what are some basic tools or practices that, our community, those listening, can maybe practice daily in a way to help better support their emotional journey?
I feel like one is connection, and I think sometimes when things happen to us, we tend to isolate. We may step back from others because we're ashamed or afraid or embarrassed, don't want to be judged, or whatever it may be. But we have a strong bleeding disorders community of people who have been through not necessarily the exact same thing, but similar things, and can relate and are looking to support others, to be a mentor to others, an auntie, father, brother, cousin. They're looking to support others, and they're looking for support.
Yeah.
And so there is something that you can give in that way. I would say reaching into community events. A tough one that's kind of a two-sided is gratitude, because at the same time, we're angry at what has happened to us.
Hard to be grateful sometimes.
Right. But even in that, it's like, I'm still here. I have today. There are certain things that I can do that other people are unable. And I remember when I first had a hip replacement and I was in a seniors water class trying to, do rehab. And I was at the time, I think I was 30, or late 20s. And I remember there was a senior in the class, and he said to me, I'm a millionaire. He said, and I'd give it all to be where you are, and I just hadn't thought about it in that way. And here I am coming off of a replacement. And just so the perspective is something that it may take some time to get there in terms of gratitude, but there are some things that we do have that we may take for granted just in all of the challenges that we deal with.
I know a big piece of what this community kind of navigates is grief, right? And loss of loved ones, and loss of somebody maybe I saw at a meeting last year and they're not here anymore. So I know you have a personal story around loss and grief, and that really deepened your commitment to this emotional piece of advocacy. Can you talk to us about that?
Yes, I can remember growing up, and then we would go to camp each year, and then when the HIV/AIDS epidemic happened, all of a sudden, every year we would do our annual visit with our social worker, me and my brother. I have two brothers with hemophilia, and we would go and talk to social worker and look at all the pictures from camp and say, how's they doing? How's this kid doing? And then, they say, oh, they're doing this. And then all of a sudden, one year, all the kids we asked about were no longer alive. They were gone. They had passed away. And I remember looking at my brother. We didn't really understand what was happening. And so having that experience of losing people in our community is traumatic. I can remember being in the hospital and my friends coming to visit me, and feeling like, looking at me having a tough time, and then feeling that they might be next. And so there's that fear and uncertainty. How I came to be connected to the hemophilia B community in a more formal way was, we had, at a point in our community, we had some blood brothers who had died by suicide. And I was asked to help navigate a conversation around that. So I was able to just hold a space for others to talk about, when we have, depressive symptoms and mood changes and different things, and think about, maybe not being here anymore. What would it be like if I didn't have to go through this anymore? and just having a conversation about it, because research tells us that talking about these things does not increase the likelihood of committing suicide.
Right.
But we're having thoughts, so we need to normalize that it's okay to think about things because we don't know what to do as humans. We're trying to figure out how to cope. But
Mhm.
what we do after that is the key.
Yeah, and so yeah, you use the word normalization, right? Creating forums and creating space for people to feel vulnerable and ask questions and explain how they're feeling amongst community, amongst people who have shared experience. So, but can we talk a little bit about creating that space for someone to say, I'm not okay"? Can you like
Mhm.
maybe walk somebody through if they're having that apprehension to be able to say those words out loud to somebody? Like, what would you tell them?
I would start with my own path, sharing my own story of being there and having to say that.
Hmm.
And I think a key is identifying safe people that you can share with,
Right.
that may be able to handle something like that.
Mhm.
I can remember going, I was working in the ER and then had to witness children being taken away by Child Protective Services. There was some abuse in a home, and then the parent had to have the kids removed. They didn't know they're going to be removed. The parent was still 7 months pregnant with another child, and then it was just a traumatic experience to witness. And I remember breaking down after that. And then
Mhm.
I saw a friend later that day, and he was like, "How are you doing?" I was like, "I'm struggling right now."
Yeah.
But this was somebody I could trust and talk to about that. And
Mhm.
so, in setting this conversation in a room, talking about depression, talking about suicide, sharing my story, and then as we are in the room, identifying that this is a safe space to talk about these things.
Right.
And so then everybody who's a part of this, that chose to be a part of the discussion or the group or whatever, what have you, they can look around the room and see, okay, this is somebody who sees me, and I can share with this person, whether it's after this or during this session. And
Mhm.
so that's part of it too, is like, normalizing it's okay to feel overwhelmed. It's okay to be frustrated, angry, depressed. It's okay. It's a part of life. How do we respond to it is where the work happens.
Yeah. So, finding a loved one, a friend,
Mhm.
a community member, hemophilia B, right? There's so many opportunities for people in this community to come together and engage in this conversation. But I think, when it comes to like speaking to a clinician or getting mental health support, like what are some warning signs that might mean I might need to take this a step further and speak to a professional?
I think, and as like, when we think about clinicians, crisis lines are always available to listen as well, right? Like 988. We have these outlets that people that can handle it. Because sometimes our family members or our friends can't handle hearing these things. I think
Hmm.
one sign for people that may need additional support is if we find ourselves telling the same story to everyone, you know, and it seems like somebody might kind of be stuck in a certain place,
Hmm.
because conversations may not be conversations. It turns into like me sharing this that I've been through.
Yeah.
And then I'm not able to hear other parts of what other people are saying because I'm stuck in this place. And that's
Hmm.
one sign I see, in just in talking with people, working with people, that somebody might need additional support. If you hear, a tone of hopelessness or questioning, kind of an existential question about life, wondering someone's value,
Hmm.
what value they bring. Those are, times when you hear that and you're thinking, for me as a clinician, thinking, okay, let's look into more where that's coming from. Is that because of something that recently happened? Did we lose someone, or has it been a long time that we felt like this?
Hmm.
Those are a couple things that I would look for, and I look to listen for in terms of seeing, how someone's doing and if additional support's needed.
Yeah. Great. Well, thank you so much for your time. And I know that you speak at all kinds of coalition events. So, thank you again so much for your energy there. And I think, if we could wrap this up with like maybe one thing, somebody can keep in mind that could support their own mental health or the mental health of a loved one, what would that be?
I think, like we talked about, normalizing these conversations, and part of it is it's okay to reach out and ask for support. I think as people with bleeding disorders, we're used to doing that in terms of our physical care. And so we're used to getting support medically, getting things handled and understanding. But I think it can be a scarier thing when it's something we're not used to. Like, wait a minute, there is no factor specific, just generally speaking. Wait, I'm feeling this way, and I don't know the path right off to fix this. I don't know how to deal with this. And so since we can't see it, there can be a tendency to like say, okay, I got this. I don't have to worry about it. I can handle this. But the body is one unit. The brain and body are together, the mind-body connection. We don't always see it that way, but they're connected. And then mood symptoms can impact, pain, feelings, and those kind of things as well. And so I would just encourage somebody, we all have challenging times, and there is a path for support and help and treatment with mental challenges, just like there is with physical challenges. It looks different, but there is a path, and we can help you to get there.
Absolutely. Well, thank you again so much for such an awesome conversation. And listeners, just a reminder that the 988 Suicide and Crisis Hotline is available. Mental health professionals are available 24/7, so you can call if you feel like you need help or if a loved one needs help. And also don't forget that you can go to hemob.org and events to find community events near you so that you can come together, have this shared experience, and share your mental health journey with others who know exactly what you're feeling. So this has been Boundless B, the Hemophilia B podcast, the podcast standing with you from a family like yours, presented by the Coalition for Hemophilia B and in partnership with Balancing Life's Issues. And Dr. Mosi, thank you again for being here today.
Thanks. Thank you. Have a good day. Take care.
Until next time, everybody, take care. Thank you for listening to Boundless B, the Hemophilia B podcast, the podcast standing with you from a family like yours, presented by the Coalition for Hemophilia B and in partnership with Balancing Life's Issues. Produced by me, Kai. Got an idea for the show? Send us an email at podcast@hemob.org, and don't forget to stay connected to your community at hemob.org. Anything else to add, Miles?
Yeah.
This episode of Boundless B, the Hemophilia B podcast, presented by the Coalition for Hemophilia B, is made possible in part by the support of CSL. We thank CSL for their continued commitment to the bleeding disorders community.